spring of 2019, one of the things me and my teams were working on with our clinicians was, from a digital perspective, how do we connect our patients and our families better? And this was truly important for us because we are a pediatric health system. Kids, by and large, are pretty healthy. So it's a small population of kids that are sick, have genetic conditions, or need transplants that we need to take care of. And there's certain things which we do better than anybody else. For solid body transplants, we're one of the best centers in the country. There are a couple of things on the heart side that we do where we've been so successful that in the last 20 years for certain procedures, we haven't seen anybody die. So zero mortality. And what's happened is now we have adults who we saw since they were born through some of our heart programs that are in their early to mid 20s. And they come to us instead of an adult cardiologist because we know their entire history, we know their complexity, and we know their journey in terms of how their body has healed and how their heart has grown. So, it's surprising when you get into a children's hospital and see full-size beds with adults laying in them. That's us. But in 2019, when we were starting to think about digital, this is the tagline we came up with. Digital transformation is an experience transformation. It's not new. It's not something we created. We co-opted it. But the intent was, how do we focus on the experience, and then how do we use digital to completely transform the experience of our patients and their families? And what we came up with were four domains to focus on for our entire digital transformation journey. On the one side, we focused on patients. How do we connect with them? How do we engage them? How do we ensure that they have access to all the complex healthcare options and resources that we provide? How do we answer their questions? And then how do they connect back to us when they need help? Then we looked at providers. And in particular, if you are in the US, you know that there's a shortage for the number of docs. We are not producing as many from the colleges that we need. Burnout is a big issue, especially in the last several years as we have started to measure it and understand the implications of it. Also, the US population is aging pretty rapidly, and over the coming decades and two, it'll put a tremendous amount of pressure on our health system. So taking care of our providers, their mental health so that they don't burn out was extremely important. And anything we can do to improve their experience as they practice medicine was paramount. From a business processes perspective, there's always this push to continuously improve, to optimize, to reduce costs and pull them out of the system. US healthcare is really expensive, and whatever we can do from an administrative perspective to reduce the cost is phenomenal. So simplifying things, reducing handoffs, and automating as much as possible was really a big focus for us. Finally, growth. How do we look at using digital tools to change how we look at our markets? So a good example of this was we started doing analytics to look at where populations were growing in Bay Area. And if you've been in Bay Area, when we were deciding where we open our next clinic, we were looking at in the city or in East Bay. And when we looked at the analytics of where populations of young people are growing so that someday they'll get married and have kids, we saw that East Bay had the biggest growth coming out. And part of it is new housing coming in that market, which is more affordable, and the fact that the city is pretty saturated. And so when we were building clinics, the next clinic came up, and as we looked at these options, the population analytics pushed us towards building more in East Bay than in the city, as an example. Early on, this is what set of projects look like for us in all of those areas. So everything from video visits to login optimization of speech recognition for the providers, to RPAs, to second opinions from a growth perspective.